Back. My name is Kyle Urban, and I serve as the director of the UC Davis Retiree Center. I'm really happy to be here with you. Happy to be back this week and to see so many folks come back for a second week. We are expecting a few more as we go along, so they'll pop in as we move. But we're really excited to have you here and really excited to get this back together. We had 113 people, hopefully many of you in this room, that filled out our survey this last week. So we appreciate that. From that, we had some themes that existed, and I wanted to cover those briefly. A lot of the questions were about healthcare, which Garen is going to cover in great detail today. There were also a great number of questions about 403Bs and 457Bs. And as a plug, next week, Spencer Richards and Kim Becker from Fidelity are going to cover both 403Bs and 457Bs. So if you can hang with us for one more week, you will have the expert in front of you that can answer those 403B and 457B questions. But before we get started today, and before I introduce Karen to you all, I wanted to ask a quick poll. And we did get some feedback that said we didn't leave this up long enough last time, so I'm going to leave it up just a little bit longer. So the first question is to rate your knowledge about health benefits in retirement. The choices are excellent, good, okay, I know a little bit, or I don't know about health benefits in retirement. The second question is, have you ever met with the UC Davis healthcare facilitator? We want to know who in the room has met with Garen. And I can imagine many of the folks saying no are going to wish that they had or wish that they will going forward. All right, we've got 68 responses. Going to leave that open here for another minute. If you haven't replied yet, please do. All right, still waiting on a few if folks do want to chime in on the poll. Like someone said
the actual poll went away. It was up for just a second and then it went away real fast.
Interesting. Okay, well, sorry about that. Well, I'll stop it there then. We kind of hit a wall at 68. So there is a little bit of knowledge, it looks like, on health insurance benefits in retirement, but not a ton, which is great because that's what Garen's here to do today. And it looks like we've had 5 people at least that have met with Garen or Erica about their healthcare choices. Again, you'll see why today. I strongly recommend it to everyone. Not all at once, but before you retire, if you get a chance to sit down with Garen or chat with Garen over the phone in today's world, we strongly recommend that. But without wasting too much of your time, I do want to transition us over to Garen. So Garen Solbach is our healthcare facilitator at UC Davis. He's worked with UC Davis retirees and emeriti as well as employees for quite some time and is easily the most relied on healthcare facilitator in the UC system. Other campuses reach out to us to get Garen's materials. They reach out to Garen directly to get those. Garen has been a huge help to our office, and I always make the same joke, and Garen's sick of it at this point, but I'll make it again. He's someone that we should have smoke and lights flashing and things going up and his name across the Jumbotron every time he comes out and come out waving and, you know, kissing babies, that sort of thing. But Garen is someone we really, really appreciate. And Garen, we're happy to have you here, and I'm going to turn it over to you.
Thank you, Kyle. And I definitely want to say thanks to Kyle and Julianne from the Retiree Center. I absolutely rely on the Retiree Center to help communicate things, to direct the right people to me when they need my help. And they're excellent at that. I really appreciate the UC Davis Retiree Center every year, for sure. Thank you so much. Well, thanks for coming to see this. I want to let you know, first off, that my name is Garen Solbach. I'm the healthcare facilitator. But what that means to you is that I'm one of a 2-person team that specializes in troubleshooting the use of UC health plans and coordinating them with Medicare for employees and retirees. So Erica Castillo and I are the 2 people at UC Davis that specialize in the health plans. When you call Oakland, when you call the RASC, the people that you speak to, they don't specialize in the health plans. So, I would encourage you to rely on Erica and I when you have healthcare questions, issues with your health plan, when you're approaching age 65 and need to deal with Medicare. If you're retiring past 65 and you need to deal with Medicare, we troubleshoot the health plans, and we've been doing it since 2002. So we know the plans really well, and we know how to navigate some of the rough waters. So I hope that this presentation helps impart some of the things that we've picked up over the years and makes your life easier as you plan for retirement. So let's go ahead and look at the objectives for today's presentation. We're going to talk about exactly what you can continue into retirement, how much service credit it takes to get this, how much you pay, who's eligible, how does Medicare figure into all of this, and is UC planning to cancel retiree health insurance? No, but rumors abound. So I want to address a little bit about the future towards the end of the presentation. So I really think that will help. And this is my laser pointer, which I hope you don't find too annoying as we go along. First, let's talk about the health and welfare benefits that you can actually continue into retirement. Erica and I specialize in the medical plans, but we also do a little bit of dental and vision, but I will also mention a few of the others as well. So if you're eligible, you're going to be able to continue into retirement: medical, dental, and legal. Those are the three things that you can deduct from your UC pension check if you have an amount to pay: medical, dental, and legal. And I know that legal is not a health benefit, but I lump it in here because it's one of those that will be deducted from your pension check. Nothing else besides tax withholding will be deducted from your pension check, which means that if you want to continue vision service plan into retirement, you'll need to pay VSP directly. Now, when you retire, you'll be offered retiree VSP. Costs about $21 a month for a retired couple. You'll eventually get a letter offering you this. But what I would encourage you to think about is this: it's actually easier for you to sign up for retiree VSP during open enrollment. So what you might do if you retire is make sure you get your glasses and contacts done before you run out of your VSP as an employee. Then during the following open enrollment, that's the easier time to sign up for vision service plan. Just trust me on that, okay? I do want to point out that the VSP for retirees is slightly different than the employee VSP. The only difference that I'm aware of has to do with the contact lens allowance. As a contact lens wearer, I was very excited that employee VSP, we had an increase in the contact lens allowance to $160 as of this year. If you didn't know that, now you know, congratulations. But the retiree VSP didn't get that upgrade, so it remains a $110 contact lens allowance for those of us who wear contact lenses. I also want to point out that if you're a Kaiser member, once you hit Medicare age, if you're retired and we put you into Kaiser Senior Advantage, the Medicare version of Kaiser is Kaiser Senior Advantage. Kaiser will charge you $20 for an eye exam, but they'll also give you a $150 allowance every 2 years towards materials like glasses and contacts through Kaiser's optical department. So something to think about as you decide whether to pay for vision service plan. Although I must add, because I've heard it from a few people, Kaiser's glasses are still expensive even when they're $150 off, but still, you should know. Other benefits. Some of you may remember what AD&D stands for. It's the ghastly named Accidental Death and Dismemberment Plan that's through the Prudential. Remember, none of these things can be deducted from your UC pension check. So if you want to keep up AD&D, you can by direct payment to the Prudential. AD&D stands for Accidental Death and Dismemberment. And if you want to know how many fingers and toes you have to lose before the plan pays, that information is on UCNet. Life insurance is over unless you convert it to an individual policy. I don't know a lot about this, but I've been told many times that there are two ways to convert to individual policies as you retire. Both are outrageously expensive. So hopefully you won't need much life insurance when you retire. Disability insurance ends the last day you're actively at work or on vacation. After that, it no longer applies. Of course, if you're retired, you're theoretically going to have income even though you're not working, which is kind of like disability insurance, I guess. Disability insurance is income replacement. You shouldn't need it when you are retired anyway. This next bullet has to do with all the tax savings programs, the health FSA, the dependent care FSA, also known as DEP care, and TIP. TIP is that program that puts your medical plan premium on a pre-tax basis. TIP doesn't apply. You can't do anything pre-tax from a pension check that I'm aware of. I don't think the IRS allows it. So health FSA, dependent care FSA, those things are over. On the health FSA side and the dependent care FSA, if you are enrolled in those plans in the year that you retire, make sure that you've incurred enough claims to be able to claim back the money that you put in as you contribute from your paychecks. Auto, home, renters, boat insurance, any of those things that you get through California Casualty or MetLife, you can continue through direct payment to those companies, as you can with these supplemental health plans through AFLAC. That's another thing that you can direct pay. If you get pet insurance through Nationwide, again, that is something you can pay to Nationwide directly. So those are the general health and welfare benefits. Let's talk about what it takes to become eligible for a UC contribution toward medical and dental so that you can continue your coverage into retirement. Well, you got to have enough service credit, okay? Medical and dental can continue into retirement if you have enough service credit and you elect monthly retirement income, not the lump sum cash out, but monthly retirement income within 120 days of terminating UC employment. Now, you might be wondering, why would somebody wait to retire after they quit? Well, what if you're age 59 and you want to hold out for that age 60 to get the highest age factor out of your pension? Well, be careful. If you retire more than 120 days after terminating UC employment, you will not be able to continue medical and dental, any health and welfare benefits into retirement. So watch out for that. Got to retire within 120 days. And your eligibility for health insurance must be continuous. So you've got to be eligible for coverage. That coverage must be continuous, and you must elect the monthly pension. Now, if you're somebody who leaves the university but does not retire, and then years later, you plan to come back to work for UC so that you can then retire from UC and get the health benefits, you can do that. But there are a couple of caveats you should be aware of. Number one, when you return, you must work at least 12 months in a UCRP eligible position. And the other thing you need to know is that if you do that, you'll be potentially in a newer, more restrictive eligibility tier, and it might take more service credit and a higher attainment of age for you to get as much toward the UC medical and dental contribution if you leave. These benefits are designed to attract and retain employees. So keep in mind that when you leave, there are often disadvantages to that, even if you do plan on returning. And if you haven't already become aware of this, if you elect the lump sum cash out, you forfeit UC health coverage. So be aware of that. So you need to have a lot of service credit to become eligible for a UC contribution, but it also matters when you join the UC retirement plan. And UC looks at 3 different eligibility groups. There's group 1, group 2, and group 3. Group 1 is for people who joined the retirement plan before 1990, and that's joined the retirement plan. I didn't say hired. I said joined the retirement plan. For example, when I first started working for UC, I had just graduated from UC Davis and I needed a job and I lived in Davis. So I joined the temp pool at UC Davis. While I was a temp, I was not a retirement plan member. So I was not earning service credit toward a pension or health insurance. Not until the benefits office hired me and I became a career employee and started, I joined the retirement plan. So if you started your career like me in a position that was not eligible for retirement, think back to when you got dental and vision coverage. Only retirement plan members get dental or vision, okay? But let's say you started before 1990. Well, if you were ages 50 to 54, you just need 10 years of service credit and you get 100% of the UC contribution, okay? I'm going to give you several examples of what 100% of the UC contribution means, okay? So we'll talk about that as we go along. But obviously, if you joined the retirement plan before 1990, it doesn't take much service credit to get the maximum. If you retire at age 55 or later, all it takes is 5 years of service credit. You can't have a big break in service, but if you have these kinds of amounts of service credit and those ages when you retire, you're going to get 100% of the UC contribution toward medical and dental. That's group one. But most of us on this presentation, including me, are going to be part of group two. Group two are those employees who joined the retirement plan on or after January 1st, 1990. If you joined the retirement plan on or after January 1st, 1990, you will be subject to the dreaded graduated eligibility. And I will explain what graduated eligibility means shortly. But what that means is that the simple way to explain it is that if you have 20 years of service credit under your belt when you retire, you get 100% of the UC contribution. But if you have less than 20 years, and service credit doesn't round up, it's whole years. If you have less than 20 years, then you're going to get some smaller percentage. That's where the graduated eligibility rules come in that I'll describe in a moment. But then there's group three. That's for people who joined the retirement plan on or after July 1st, 2013. If you're even newer, you are subject to an even more extreme graduated eligibility. It's going to take you not just 20 years of service credit to get 100% of the UC contribution, but you'll also have to be at least age 65, and you won't even be able to get a contribution from UC unless you retire at age 56 or later. So the newer people have it harder. The people who've been here for a while have it easier. That's really how it works. But let's get into what does graduated eligibility mean? Because most of us are going to be group two. We are going to be people who joined the retirement plan between 1990 and June 30th, 2013. Okay. Graduated eligibility means that the percentage of the UC contribution you get determines the percentage that UC pays. And keep in mind, we're talking full years of service credit. 19.5 years of service credit does not round up to 20. That's 19 years of service credit for these purposes. So for example, you know that 20 years gets you 100% of the UC contribution. But this chart will tell you that 0 to 4 years gets you nothing. Of course, you can't even retire and get a pension with less than 5 years of service credit. But let's say you join the retirement plan late in your career. I did not call you old, but if you join the retirement plan late in your career and you have less than 10 years of service credit, if you have 5 to 9 years of service credit, you might qualify through what we call the rule of 75. If you qualify for the rule of 75, you get 50% of the UC contribution toward medical and dental coverage, and I'll tell you later how to calculate it. If your age plus your service credit equals at least the number 75, then you're going to get 50%. So that means that if you retire at age 69 with 7 years of service credit, for example, you're going to get 50% of the UC contribution. Okay. So you have less than 10, but your age plus your service credit equals at least 75. You're going to get 50% of the UC contribution. Otherwise, you'll get 50% with 10 years of service credit. And for every full year of service credit you have above 10, you get an additional 5%. So that means 10 years of service credit gets you 50%. 11 years of service credit gets you 55%. 12 years gets you 60%, and on and on and on. So 15 years gets you 75% of the UC contribution. 19 years gets you 95% of the UC contribution. Why not stay another year? That's why the benefits are designed this way, is to keep you here as long as possible, because 20 years would get you 100% of the UC contribution. so that you wouldn't be subject to graduated eligibility. You'd get the whole shebang, 100%. Okay. Now, some of you may have questions about this. We're going to hold questions until the end, but I know that this can be confusing for some people. And if you don't get an answer to it, if you're not sure what percentage of the UC contribution you would get, feel free to give me a call sometime. Erica and I deal with this stuff all the time, and we can help you if you're stuck. But now let's talk about graduated eligibility for the people who are in group 3, the people who joined the retirement plan most recently. Hopefully there are not that many of you in here because you probably cannot afford to retire yet anyway, but the more extreme graduated eligibility looks like this. 10 years of service credit at age 56 gets you only 5% of the UC contribution. My goodness, it's terrible. Obviously, you need to stay here longer, and you need to be older as you retire. So if you're in group 2, a good goal would be to get 20 years of service credit. If you're in group 3, a good goal would be to get 20 years of service credit and be age 65, if you possibly can. 15 years at age 60 only gets you 37.5%. 20 years at age 60 only gets you half. You got to be 65 and 20 or more years of service credit to get 100% and not be subject to graduated eligibility if you're in group 3. Now, if you're somebody who had a break in service and was rehired, you're going to be subject to this tier, to this group, if you re-entered the retirement plan on or after July 1st, 2013. But if you're somebody who fully retired and started getting a pension and then stopped your pension and came back to work for UC, then you're a rehired retiree. And if you're a rehired retiree, you would retain your original eligibility through group 1 or group 2 rules when you re-retire if you were eligible at that time. So I hope that makes sense. Again, if this gets complicated, if you can't get your questions answered during this presentation, you can always give me a call later. Now I'm going to present this bar chart 4 times during this presentation. This bar chart is a visual representation of the UC contribution. So the gold bar here, this gold bar on the left, that's the UC contribution. This is the gold bar that we are all working toward as we plan for our retirement, okay? This is one of the reasons you're working here at UC. It's not necessarily for the salary. It is for the pension and the health and welfare benefits that are, our plans are really nice for retirees. The only way to do better would be to retire from the military, I would say, or work for the state of California. I've got to give it up to the state, Their benefits are pretty nice. They can raise taxes. We can't. All we can do is charge patients more and raise tuition. But anyway, our benefits are excellent. This gold bar represents 100% of the UC contribution if you qualify for it. The blue bar is a sample medical plan premium for somebody that doesn't have Medicare. Notice that there is a net cost here. Just like now, when you're an employee getting 100% of the UC contribution, when you're retired, the plan tends to cost more than UC will pay, right? So you end up paying the difference. That's your net cost. Now notice that the red bar is a sample retiree medical plan premium for someone who has Medicare. Medicare plans tend to be nicer and less expensive per month. So the premium is lower. That's why the red bar is lower than the blue bar. And that's why a goal for you might not just be 20 years. It might just be age 65 also, so that you pay the least for your medical plan into retirement, because Medicare is extremely valuable. But we'll talk more about Medicare later. Right now, I want to focus on that blue bar and that net cost and give you a real world example. This year, 2022, if you were an employee who retires with 20 or more years of service credit, and you're in group 2, like most of us would be, you're not going to be subject to graduated eligibility. You're going to get 100% of the UC contribution. And let's say that you retire with HealthNet, the UC Blue and Gold HMO, and you're covering a spouse. Well, HealthNet for 2 people, whether you're an employee or a retiree, the premium is $1784.71 per month. That's how much Health Net requires to cover 2 people. It's shocking, right? $17.84 a month is a lot of money. Fortunately, UC is going to bear the brunt. The maximum UC contribution towards 2 retirees who don't have Medicare is $1,176.57. Well, this total premium is offset by what UC will pay, leaving a balance of $608.14 per month. $608.14 is what would be deducted from your UC pension check in this example to pay for you and your spouse's Health Net into retirement. But now let's go back to that bar chart and think about, what if you don't get 100% of the UC contribution? What if you are subject to graduated eligibility? Well, then that gold bar is lower. In this example, this is a 50% example. Let's say you're retiring with 10 years of service credit. You only get 50% of the UC contribution. That gold bar is cut in half and it's down to the 50 level. Well, that means that your net cost, the difference between what your blue medical plan premium costs and what UC will pay, the gold bar, that difference is much larger, much larger. Even if you have Medicare, this net cost is going to be much larger. So this should show you that it's very important to join the university as soon as you can and work here as long as you can to squeeze the most that you can out of the benefits, okay? So this is a 50% example visually. Now let's look at the actual numbers. Here again, we have an employee retiring with who's in group 2, but this time they only have 10 years of service credit, so they're only getting half of the UC contribution. They're only getting 50%. To keep things simple, we're sticking with Health Net Blue and Gold, the UC Blue and Gold HMO in this example, and this employee is retiring covering a spouse. So 2 people in Health Net, the premium is still $1784.71. That's how much Health Net has to charge, regardless of how much service credit you have. Unfortunately, in this example, the UC contribution is cut in half. Remember that the maximum that UC would pay was $1176. Well, half of that is $588.29. So if the total premium is $1784.71 and UC is paying $588.29, that leaves a net premium to this retiree of $1,196.42 per month to be deducted from their UC pension check. Okay, so this example should encourage you to hang in there. Remember, the benefits are designed to get the hooks in you and keep you here as long as possible. And I think this illustrates that. I'm going to get into more examples about the premiums for those who have Medicare and how to calculate your premiums and that kind of thing. But before we get into some specifics, I want to share some general things that you should know about the retiree health package at UC. The first thing you should expect is that it's pretty much the same medical and dental plans that you have as employees. But there are differences due to Medicare that I'll get into as we go through the presentation. I told you before, Medicare is very valuable. It makes the plans better and cheaper, but also there are plans that you can choose when you have Medicare that you could never choose when you didn't have Medicare. So it actually opens up some things that you couldn't get into before. But other than that, it's pretty much the same menu of medical and dental plans. It's also the same eligibility rules for family members. People, I've gotten many questions about this, you know, can UC retirees cover a spouse? And of course, it's actually the same rules for family member eligibility as it is for active employees. So we cover children and grandchildren and stepchildren and domestic partners and spouses, and all those rules are the same, whether you're an employee or a retiree. And just as when you're an employee, as a retiree, you may be contacted by a company, a third party that UC uses to verify family member eligibility. This company is called Unify HR. If you get something from Unify HR, you need to pay attention to it, okay? This is the company that UC pays to figure out if you still are covering family members who are eligible. You would not believe how many millions of dollars UC has lost because people failed to take off their ex-spouse. We don't know when you've gotten a divorce unless you tell us. So, you know, every once in a while, you may be asked. You might be asked for a marriage certificate or a birth certificate or whatever. You need to comply with those requirements. If you get mail from Unify HR, it should also say University of California on it. you need to make that responding to that a priority of your life, okay? Something I also want to point out is survivor benefits. One of the valuable benefits that you have at UC is that our retirement plan will continue to pay your surviving spouse if you predecease them, okay? This is an extremely valuable benefit because if you pass away and your surviving spouse is eligible for a survivor's pension, if they get the pension, they also get the health coverage. So that's extremely important to many, many people who worry about their spouse if something were to happen to them. Here at UC, we have pretty much built-in benefits that help your surviving spouse. Now, I've got to warn you about something that is a nuisance, but we can't easily stop it. So I want you to expect to ignore a couple of letters, all right? When you retire from UC, you are going to get a letter from your medical plan. Once your medical plan realizes that you're no longer going to be covered by UC Davis, they are automatically going to send you a letter saying that your coverage is terminating. That's normal. Don't let it raise your pulse at all if you're going to be eligible for retiree health coverage. They have to send you that letter. They don't know that you're going to be eligible for retiree coverage. So they're going to send the termination letter, whether you get the retiree coverage or not. Don't let it bother you. The other letter that you need to ignore is a COBRA continuation offer from a company that UC uses called WEX. WEX, formerly called Discovery Benefits, they changed their name to WEX. They send you a letter saying that you can continue to pay for your UC coverage directly through them, and it's outrageously expensive. And you get this letter. If you read the letter carefully, it will say to ignore it if you're eligible for retiree coverage. But I've had so many people, become extremely concerned when they get this letter. Don't be. If you're going to be eligible for retiree coverage, ignore the COBRA continuation letter. Don't send WEX a check for $1,700, okay? Just ignore the letter if you'll be eligible for the retiree health benefit. Your continuation of coverage will be essentially automatic as long as you don't take the lump sum cash out if you're eligible, and as long as you don't tell the retirement system that you don't want the coverage. As long as you don't tell them you don't want it, you're going to get it. Everything's going to be okay if you're eligible. Something else you should know, UC does not salary band retiree health premiums. So there aren't higher premiums for the high income and lower premiums for the low income. We don't know who's high and low income because the UC pension is only a part of somebody's retirement. The retirement picture would include retirement savings accounts. It would include pensions from Social Security and maybe other employers. We don't know who's rich and who's poor, is what I'm trying to say. So UC does not salary band retiree health premiums. I will warn you though, Medicare does charge super high income people more, and they get a file from the IRS every year. So they know exactly how much money you make, and they will charge you more if you're in the top 5%. We'll talk more about that later. Something else that's similar about retiree health coverage, same as now when you're an employee, you will always have a fall open enrollment period. In fact, it's the same open enrollment period that employees have, which is why if you're trying to reach me during open enrollment, it can be very difficult because Erica Castillo and I are the only two people who specialize in the medical plans at UC, or at UC Davis. So please be patient with us. If you leave me a message, I will call you back. It just may take me a week during open enrollment. Just like employees, you can suspend your medical and/or dental coverage when you're a retiree. Maybe you don't need our coverage because you're going on to a different job after you retire, or maybe you get coverage through a spouse. That's okay. You can suspend your coverage and get back in later if you need to during open enrollment, or if you can prove a loss of other coverage, no problem. Just don't cancel your coverage, suspend it, okay? Just like when you're an employee, you will have 31-day periods of initial eligibility. The PIE, or period of initial eligibility, is probably a term you have not heard since new employee orientation many years ago, but it still exists. It's that 31-day window for you to take action on your health coverage when you have a life event like the addition of a newly eligible family member. Yes, retirees can enroll a new spouse even after retirement. Okay, I know that there's a rumor out there that once you retire, you can't enroll a new spouse. That's not true. What is true is that if you are not married to your spouse for at least a year prior to retirement, then they will not be eligible for a survivor's pension. Okay, for a spouse to be eligible for a survivor's pension, you have to be married for at least a year prior to the employee's retirement. But that doesn't mean you couldn't enroll a new spouse after you retire. You certainly can. Give me a call, especially if you know when you're going to get married in advance. If you can do it in advance, let's get the paperwork done in advance. Give me a call and I will help you understand exactly what you need to do to enroll when you add this new family member after retirement. Or maybe you're not covering your spouse and your spouse experiences an involuntary loss of other coverage because they retired from a job, or they quit a job, or they were laid off from a job and they lose the coverage over there. I'll need proof that your spouse lost that other coverage, but you can sign them up at any time as long as you take action within 31 days, and I will need proof of that other loss. And yes, even if you voluntarily quit a job, if you lose the coverage because you retired, for example, your spouse retired from another job, it's still considered an involuntary loss, even though you voluntarily retired. Don't worry about that. Now, there is another special PIE, and that's for people who are in my favorite health plan at UC, the UC Health Savings Plan, which I consider to be the nicest plan that UC offers. If you or a covered family member obtain Medicare and are covered by an incompatible plan, the UC Health Savings Plan is incompatible with Medicare, then we have to give you your own open enrollment when you're a retiree to choose something else. So again, give me a call me or Erica 3 months prior to the month in which you turn 65 or your spouse turns 65. Or if you are retiring past age 65 and you have the UC Health Savings Plan, get in touch with me before you retire and let me help ease you through the process. Because the UC Health Savings Plan is the only plan UC offers that features a health savings account, an HSA, and HSAs and Medicare are not compatible under IRS rules. Medicare, the IRS only lets you put money pre-tax into an HSA if you are only covered by a qualified high deductible medical plan like the UC Health Savings Plan. Medicare's deductibles are not high enough. Another opportunity to make a change would be if you were to move or travel outside an HMO's service area for 2 or more months. Okay, trust me, retirees do not sit still. Once they retire, they travel all over the place. They might move. They might spend 6 months on the East Coast and 6 months on the West Coast. That's fine. But if you have an HMO, geography is destiny. An HMO is an insurance arrangement where the insurance company prepays a local retirement plan to take care of you. So HMOs don't work outside of urban California. You can't even move to Chico to be near the Sierra Nevada Brewery and keep an HMO. You would have to change to health insurance if you're going to do that. So again, try to give us lead time. Give me a call and I will try to help you find an alternate health plan if you're in an HMO and you're going to be outside that service area for more than 2 months. Now, this is the screen that is going to tell you how to calculate your retiree health premiums. Okay. If you are eligible for 100% of the UC contribution, you'll be able to find the retiree rates easily on UCNet. But if you're not eligible for the UC contribution at 100%, if you're eligible for some percentage in between and you want to know how much you would pay, I have tools for you. These tools are Excel spreadsheets. Okay, so if you go to my website, the Healthcare Facilitator Program website, hr.ucdavis.edu/HCF, you are going to find links right on the homepage and under presentations for employees and presentations for retirees. You are going to find a link to an Excel spreadsheet called the UC Retiree Premium Estimator. This is an Excel spreadsheet that you can download and indicate which retiree insurance group you're in. You can enter your age at retirement. You can enter how much service credit you have in whole years, and it will tell you how much the plans cost. No matter how many family members you're covering, it'll tell you premiums with and without Medicare. If you have Medicare, but your spouse doesn't, if your spouse has Medicare, but you don't, you can get rates for all of those things. And the estimator includes a link to Medicare's premium page, so you can figure out how much Medicare might cost you. So this is an extremely valuable tool for figuring out what your budget might be after you retire. Feel free to use it. It's on our website, and I update it every year. And especially for those who are moving, but just in general, know that HMOs are not available outside urban California. As such, you might be wondering, well, where does that border lie? Well, you can use another Excel spreadsheet on our site, the UC Medical Plan Availability Tool. Download that thing, enter your zip code, and choose the county that you're in. And you need to indicate a correct county and zip code combination, okay? The tool does not know what counties overlap what zip codes. So you have to give it an accurate zip code and an accurate county for where you might be living. And it will tell you whether an HMO is available there. Otherwise, you'll have to choose a PPO. Okay, so those are two tools that you can use now and you can use later after you retire when you need to know more about the health plans. Next, let's talk about Medicare. This is what a Medicare card looks like. It's red, white, and blue. It's printed on thick cardstock paper. It is not plastic. So I'll warn you now, you may have gotten a Medicare card in the mail and not even realized it because you can't feel it through the envelope if you become eligible for Medicare because you're 65 or disabled or something. You know, I like to joke that it's red, white, and blue, but this card should be green because Medicare is worth a ton of money. For those who don't already know, Medicare is the federal health insurance program for retired people in the United States. It's their primary source of coverage, okay? Medicare is for people who are 65 and over. You can get it when you're working, you can get it when you're retired, but you have to be 65 or over, or you can qualify for Medicare before age 65 if you're disabled for at least 24 months and getting Social Security disability income, or you might get Medicare because you have an ALS, Lou Gehrig's disease diagnosis, or permanent kidney failure or something like that. There are ways to become eligible for Medicare before age 65. Hopefully you won't have to use them, but most people get Medicare at age 65. There are multiple parts of Medicare, and it's really not super important for you to know too much about what the different parts of Medicare pay for, but it's very important that you know what to sign up for when you retire, or if you turn 65 after you retire. But I'll tell you a little bit about it. Medicare Part A is the hospital part of Medicare. It pays for facility fees in a hospital or skilled nursing facility. Medicare Part A is premium free for most people. If you paid into Social Security for at least 10 years, you're most likely going to get Medicare Part A for free. If you didn't pay into Social Security yourself, but you married wisely, you married somebody who paid into Social Security for at least 10 years, if that person is at least age 62, again, you're going to get Medicare Part A for free. Most people can get Medicare Part A for free. Medicare Part B, as in boy, however, that's the Medicare medical part of Medicare, and it's not free. It costs at least $170.10 per month in 2022, more if you're high income. Okay, Medicare Part B pays for most outpatient things like physician fees, technically in and out of the hospital. It pays for physician fees. It pays for things like durable medical equipment, diagnostic lab work and imaging, emergency room, those kinds of things. That's all Medicare Part B as in boy. And like I said, it costs at least $170.10 per month, but more if you're in the top 5% of earners in the United States on Medicare. it costs more if your modified adjusted gross income from 2 years ago exceeded $91,000 or $182,000 if you're a couple filing jointly on your taxes. So you might be wondering, why 2 years ago? In 2022, Social Security is going to determine your medical premiums for Medicare based on your 2020 taxes. And that's because they need to set premiums on January 1st and nobody's done their taxes yet. We all have until April 15th to do our taxes. That's why Social Security uses 2-year-old tax information. And if while you're working, you are making money above these thresholds, then they're going to charge you more for Medicare. Now, you might be wondering, what is the M in modified adjusted gross income? Your MAGI is your AGI from 2 years ago plus tax exempt interest income if you have any. Now, my understanding would be if you have tax-free municipal bonds or something like that, you might have tax-free interest income that they would add to your AGI to determine these numbers. But that's what your modified adjusted gross is. It's your AGI from 2020 plus tax exempt interest income. And you might be thinking, well, wait a minute, I make more than that now, but I won't be making that kind of money when I'm retired. Well, Social Security won't know for 2 years that you're making less money after you retire. So you may need to appeal your premium based upon work stoppage, which is a term for retiring or quitting a job. So know that there is an appeals process, but they're going to charge you more if you're in the top 5% of Americans on Medicare in terms of earnings. Now, I mentioned that Medicare is very valuable. UC actually relies on Medicare to offset the cost of insurance, not just for employees, or not just for retirees, but for employees. Obviously, Medicare is the primary insurance for retired people. So it obviously directly reduces the cost of coverage and improves the coverage for retirees, but it also indirectly offsets the cost of employee insurance, because the people on Medicare who tend to retire tend to be the older, the more costly, the disabled who are more costly. So Medicare indirectly is improving our employee premiums right now. And because Medicare is primary and bears the brunt, Medicare coordinated plans usually cost less. Usually people save a bunch of money as soon as they get Medicare, unless they are super high income and their modified adjusted gross is above 91,000 for singles and 182,000 for couples filing jointly. Now, this can lead to some confusion about when a retiree might have Medicare, but their spouse doesn't, or their spouse has Medicare and the retiree doesn't. So I want to show you this table to try to clear things up. This table displays the Medicare partner plans, that is the Medicare versions of our non-Medicare plans. And it also shows the mix of medical plans that a mixed Medicare family would have. That is a family that is partly non-Medicare and partly Medicare. So Medicare is in red and it's on the right. Non-Medicare is on the left. So let's take a look at the first two rows. These are Anthem Blue Cross plans, Core and UC Care. If you're an employee who has Core or UC Care and you retire and you're 65 or older and have Medicare, or your spouse is, for example, then you're going to need to enroll in Medicare and then enroll in the UC Medicare PPO. The UC Medicare PPO is a spectacular medical plan, better than any active employee plan. Amazing hearing aid benefits. It has amazing out-of-country benefits. You can go to any Medicare provider. It is spectacular. If you retire with Medicare, that's what we're going to put you in. Or if your spouse is in Medicare and you're not, you might stay in Core or UC Care, and only your spouse will get the UC Medicare PPO upgrade. But in that example, you would obtain Medicare and then coordinate Medicare with your UC coverage to get into this sweet plan, the UC Medicare PPO. So the Medicare version of Core and UC Care is the same plan, the UC Medicare PPO. For those of you who have HealthNet, if you have the UC Blue and Gold HMO, the Medicare version of that plan, the Medicare partner plan, isn't HealthNet anymore. It used to be. It used to be HealthNet Seniority Plus, but that plan was not a good deal for our retirees, and UC has replaced it with a United Healthcare Medicare Advantage PPO called UC Medicare Choice. I will explain what Medicare Advantage means in a moment. But for now, understand that the UC Medicare Choice plan is a much nicer plan than Health Net. It's actually health insurance. And like the UC Medicare PPO above it, it lets you go to any Medicare provider. Although fewer providers will take this kind of plan, it's still a big improvement over Health Net. Health Net's going to limit you to the doctors that are prepaid to take care of you in your primary medical group. And that's that, except for emergency rooms. Whereas with these PPO plans, you can self-refer to any Medicare provider. You can go to UC Davis and Sutter and Mercy and Hill Physicians and Woodland Clinic and UCSF all at the same time if you wanted to with these plans for the most part. Okay, so the Medicare versions of our employee plans just tend to be better. If you're a Kaiser member, the Medicare version of Kaiser is Kaiser Senior Advantage, which is a Medicare Advantage HMO, nicer hearing aid benefits, some coverage for glasses that I mentioned earlier. So again, the Medicare plans for retirees tend to be nicer than the active employee plans. And you usually win as soon as you get Medicare. The people who don't necessarily win on premium, though, are the people in the top 5% who make more than 95% of Americans on Medicare. Those people have to pay so much for Medicare. They may still be saving money, but they may not be saving as much, or they may be spending more money than they were before if they're really, really high income under Medicare's premiums, which you can find on Medicare.gov if you're interested. So this chart is something you may need to reference in the future. I think it makes things a little simpler. But now we're back to that bar chart, okay? I want to give you another example of 100% of the UC contribution, but this time focusing on the Medicare eligible medical plan, a Medicare coordinated medical plan. So again, the gold bar that we're all working toward, the UC contribution is set to 100% of the UC contribution. This example, this person is not subject to graduated eligibility. They're getting 100%. I want to focus on the red medical plan premium for somebody who has Medicare. Notice that the net cost is smaller than if they didn't have Medicare, right? So let's take a look at that net cost. Here's the actual numbers. This is a similar example to the first example I gave you, except that it's a UC Care example. Here we have an employee who is retiring with 20 years of UCRP service credit. They're in group 2. With 20 years of service credit, they're going to get 100% of the UC contribution, no graduated eligibility. This employee is retiring with UC Care, the Anthem Blue Cross PPO, UC Care. Again, this retiree is covering a spouse, but this time both the employee and the spouse are retiring and will be eligible for Medicare. So that as the employee retires, they and their spouse are going to need to apply for Medicare. Erica and I help people with that all the time. The Medicare version of UC Care isn't UC Care. It's the much nicer, vastly superior UC Medicare PPO plan. It's also through Anthem Blue Cross. This retiring couple is going to be enrolled in the UC Medicare PPO, which has a much lower premium than UC Care does, even though it's superior. The total premium that Anthem Blue Cross has to charge for this plan for 2 people with Medicare is $899.70 per month. $899.70. The maximum that UC will pay toward a couple who has Medicare, $624.34, which leaves a premium difference of $275.36. Now that $275.36 would be deducted from this retiree's UC pension check. But that's not the whole story, because to have Medicare, you have to pay for Medicare Part B as in boy, right? So you got to factor in the cost of the Medicare Part B premiums that this retiring employee and their spouse will have to start paying. And that's $170.10 per month times 2, which works out to be $340.20 per month. So this employee is retiring. They're going to get a pension check from UC. From that pension check, $275.36 is going to be deducted. But they also have to pay for Medicare at $340.20 per month. That $340.20 would be deducted from their Social Security income if they get any. Some people hold out for a later age. If you're not getting a Social Security check, then there's nothing for Medicare to be deducted from. So Medicare will bill you. Medicare will bill you quarterly. And it's very important that you pay your Medicare premium, okay? When you're retired, if you fail to pay your Medicare premium, your Medicare will be canceled and it's a nightmare. So don't let that happen, okay? But anyway, this retiree's pension check will be deducted by $275. Their Social Security check will be deducted by $340, or they'll pay their premiums separately. $275 plus $340 means that the total outlay per month for this couple, $615.56 a month. That's their total outlay per month for the spectacular UC Medicare PPO, which is nicer than any active employee plan. I'm not exaggerating when I say that if you have the UC Medicare PPO, you could get a $6,000 pair of hearing aids and fall down the stairs in Paris and get 6 weeks of physical therapy on your torn rotator cuff, come back to the United States and have a kidney transplant, and you still wouldn't spend more than $1,500 plus copays for drugs, and you'd have access to almost 1 million doctors across the United States. It's spectacular coverage. But I want to give you another example. That plan is really nice. UC Medicare PPO is really nice, so it's a more expensive plan. Here's an example of a plan that doesn't cost as much. Medicare Advantage plans, which I will explain in a minute, they are generally inexpensive. Medicare Advantage plans always cost less because you're giving your Medicare away to a private insurance company, and Medicare is paying that insurance company to pay the claims, which brings the premium down. Medicare Advantage plans charge less because they want Medicare's money. Okay, so we get a really good rate with Medicare Advantage plans. So we're back to the bar chart with the UC contribution set to 100%. But this time, the red bar is shorter, it's lower. The red bar is lower because in this example, it's a cheaper Medicare plan. Because the red bar is lower than the gold bar, that allows for what we call Medicare Part B reimbursement. Medicare Part B reimbursement occurs when you choose the less expensive medical plans that cost less than what UC is willing to pay. And when that happens, because we require retirees and their family to enroll in Medicare, if there's money left over, we add it to your UC pension check. We call it Medicare Part B reimbursement. It's not taxable. It's just, it just increases your UC pension check by whatever's left over after we pay your Medicare premium, after we pay your medical plan premium. So this is only available to the least expensive Medicare coordinated plans. And by the way, yes, the Excel spreadsheet I talked about, the UC retiree premium estimator, it will calculate your Medicare Part B reimbursement if you're eligible for it. Well, here's the example in numbers for a couple that is eligible for Medicare Part B reimbursement. Here again, we have an employee retiring with 20 years of service credit, so they're getting 100% of the UC contribution. They're retiring with Health Net, the UC Blue and Gold HMO, and they're covering a spouse. This time, both people will have Medicare. The employee is retiring past age 65. Their spouse is also eligible for Medicare, so they're going to enroll in Medicare. They're going to get their Medicare cards showing Parts A and Part B. They're going to do what they need to do to enroll in the UC Medicare Choice Plan, the Medicare Partner Plan for Health Net. And the total premium for this plan is much lower than for the other plan we talked about. It's $394.24 a month that United Healthcare charges for this Medicare Advantage PPO. Remember, Medicare Advantage plans are all cheap, and United Healthcare is gigantic, much bigger than Health Net. So we get a spectacular rate for this plan. And yet the plan is still better than Health Net in many ways. Now, the maximum UC contribution is $624.34 for a couple with Medicare. So this number is actually higher than what United Healthcare is charging, which leads to that Medicare Part B reimbursement. And here's how you calculate that. Well, first of all, don't forget that you're paying for Medicare separately. If you're a retiree with Medicare, you're paying $170.10 per month at least. If you're high income, you're paying more, but let's assume that you and your spouse are paying $170.10 each, which is $340.20. That's what you're paying for Medicare. But UC is actually going to add $230.10 to your UC pension check. Your UC pension check will go up by $230.10 per month. That's the difference between the $624.34 that UC is willing to pay and the $394 that United Healthcare actually has to charge. That difference is added to your pension check as Medicare Part B reimbursement, $230.10. So if you're paying $340.20 for Medicare Part B out of your Social Security check, but your UC pension check is going up by $230.10, your net cost is $110.10 per month for this retired couple. $110.10 is your net outlay for the two of you between the $340.20 that's coming out of your Social Security checks, or that you're paying manually if you don't get Social Security checks, and the $230.10 that's extra on your UC pension check. That's how it works. I hope that helps make things a little clearer. And if it's not clear to you, playing around with that UC retiree premium estimator, that Excel spreadsheet may help you understand it further. So as you can see, Medicare is super, super valuable. It is worth a lot of money. When you retire, if you retire past 65 or you retire and turn 65, you've paid a lot of taxes to get Medicare, and it's worth a lot of money, and you've got to use it to your advantage. As such, UC has a bunch of fussy rules around Medicare. So retirees, not employees, retirees and their covered family members must enroll in Medicare Part B as in boy if they are enrolled in medical insurance and live in the United States. Medicare doesn't pay outside the US. And if they can get Part A for free. So not employees, but remember this, retirees and their covered family members must enroll in Part B if they can get Part A for free. If A is free, you must have B. Feel free to chant that with me. If A is free, you must have B. I hope that helps you remember that retiree rule. There are some exceptions to it. If you retired past age 65 and before July 1st, 1991, we didn't have that rule back then. And you've got to understand that if you don't enroll in Medicare when you're supposed to, you will be sorry, because those who retire past 65 and fail to enroll in Medicare timely, or people who retire and then turn 65 and fail to enroll in Medicare timely, you may be subject to lifetime late enrollment penalties from Medicare. Okay? Let me explain a little bit about that. UC does not require active employees or their covered dependents to enroll in Medicare. We don't require it because when you're working, Medicare is secondary to coverage through active employment under federal law. Not always, but almost always. Okay, there are exceptions for tiny companies. There are exceptions sometimes for cases of permanent kidney failure. But generally, Medicare is going to be secondary to health coverage you get when you're working. That means that if you enroll in Medicare, it doesn't save UC any money when you're working. But Medicare, when you retire, becomes primary, and then it saves everybody a lot of money. So that's when you must enroll in Medicare. So as such, when you're retired, you got to have Medicare. Now, I want to point out that you avoid late enrollment penalties if you enroll in Medicare at age 65, or you are continuously covered by health coverage through active employment from age 65 on, and then immediately enroll in Medicare upon retirement. You won't have late enrollment penalties to worry about. I know that when you turn 65, you will be bombarded with solicitations from every insurance company out there who wants a piece of your action. They want your Medicare money. They want you to sign up with them, et cetera. I know it creates a sense of anxiety. Don't let it. You don't have to enroll in Medicare if you are still working here. You might want to enroll in Medicare Part A. And there's a lot to think about there. There's a lot of nuance to understand. I have an entire webpage dedicated to the topic of Medicare and active employees. If you go to the Healthcare Facilitator Program website and click on Medicare and active employees, you'll learn a lot more that I don't have time to talk about now. But one thing I want to point out is that if you are covering a domestic partner, Domestic partners of active employees may not be eligible to defer enrollment in Medicare without a penalty. You might not. You need to check with Social Security. Okay. Check with Social Security if you are covering a domestic partner. But UC doesn't require your domestic partner to enroll in Medicare. But if they don't, they may be subject to late enrollment penalties for the rest of their lives if they don't enroll in Medicare at 65. Spouses, no problem. But domestic partners, be careful. Okay. Remember, if you're a retiree, if you can get Medicare Part A for free, you must have B. But if you're an employee, UC doesn't need you in Medicare at all. And some of you may have never paid into Social Security because you've been working for us since the 70s or whatever, when you didn't have to do that. Well, remember, even if you didn't pay in to Social Security yourself, you can be eligible for Medicare Part A if you married wisely. You can be eligible for Medicare Part A for free through a current or former spouse. It could even be a deceased spouse. It could be an ex-spouse that you hate, but you may still get Medicare Part A for free if you were married for at least 10 years to that person, if they're at least age 62 when you're 65. Okay. So that's the general list of UC's fussy Medicare requirements for retirees. Now, I mentioned Medicare Advantage earlier. What does that mean? It means that there are two ways to use Medicare when you have Medicare. You can either have Medicare pay first and somebody else pay second, or you can give your Medicare away to a private insurance company. That's Medicare Advantage, when an insurance company is prepaid by Medicare to take care of you. That's how our HMO Medicare partner plans work. So let's say you're retiring and you're old enough for Medicare. If you have Medicare Parts A and B, and you're in one of our HMOs, you've got to assign your Medicare benefits to the insurance company. There is a form for that. We'll help you. Okay, there are a couple of ways to do it. There's a paper form you can do. There's also a way for you to do it using UC Raise. That's new, so you may want to stick to the form. But call me, call Erica if you are going to do any Medicare coordination. We are very good at knowing what to tell you to ease you through the process. We can help you enroll in Medicare with less pain and trouble, and we know exactly how to help you coordinate Medicare with your UC retiree coverage. So lean on us. But if you're in an Advantage plan, Medicare is going to pay a flat monthly fee to that plan. So you can't just use Medicare and go to any Medicare provider. You can only go to the providers your Medicare Advantage plan will let you go to. Well, remember, the UC Blue and Gold HMO, that Medicare partner plan is the UC Medicare Choice Plan, which is a United Healthcare Medicare Advantage PPO. United Healthcare will let you go to any Medicare provider. Not all Medicare providers take Medicare Advantage plans, but a lot will. Okay. If you're a Kaiser member, then the Medicare version of Kaiser is the Kaiser Senior Advantage Plan, which is a Medicare Advantage HMO. Medicare or not, you're still going to be limited to just Kaiser hospitals and just Kaiser pharmacies and just Permanente doctors. Okay. So if you're not in Kaiser and you have Medicare and you're retired, you have access to tons of doctors, but not so with Kaiser. You're still going to be limited to Kaiser. Okay. By the way, when you're in a Medicare Advantage plan, you'll have access to more doctors through United Healthcare, but United Healthcare will require prior authorization if you do anything expensive. That's not true if you have Medicare free and clear, but when you're in an Advantage plan, the Advantage plan can require prior authorization before you do things that are expensive. The way it works with our Anthem Blue Cross plans is that Medicare is primary, Blue Cross is secondary, you pay third, if anything. Okay. And Medicare does not require prior authorization. So if you have an Anthem Blue Cross plan and Medicare is your primary, you'll have the maximum access to doctors, and your doctors will control your healthcare because Medicare doesn't require prior authorization. So that's a big advantage. Remember that if you're in the core or UC Care plan, you're going to go to the UC Medicare PPO. That is the Medicare partner plan. And because Medicare is primary, you've got to use Medicare providers, but it's easy. Almost everybody's part of Medicare. Fewer than 1% of US physicians have opted out of Medicare that means that you are going to be able to theoretically access almost 950,000 physicians nationwide, not including pediatricians, okay? Most of the doctors in the United States are part of Medicare. Not everybody's accepting new Medicare patients. Some people have full practices, especially in the primary care area, but most doctors are part of Medicare. You have massive access. You have access to more doctors through Medicare than you could through any private insurance plan. But then there's this other plan that I mentioned earlier, the UC Health Savings Plan. It doesn't coordinate with Medicare. Remember, I said that because it has an HSA, it's not compatible with Medicare. Well, if you retire with the UC Health Savings Plan and you are a covered family member or eligible for Medicare, we have to give you your own personal open enrollment to choose something else. So get in touch with me, I will help you, okay? But I want to point out that the UC Health Savings Plan is not offered to retirees. So if you are an employee and you retire and you're not eligible for Medicare, you can keep the UC Health Savings Plan. You can keep pumping money into that HSA until you or a covered family member become eligible for Medicare, but not after you retire. After you retire, you can't choose that plan. So if you want it, you better get it as an employee so that you can then retire with it. Something to think about. Now let's talk about Medicare Part D, as in drugs. If you have Medicare Part D, you're going to see this symbol, Medicare RX, which means Medicare Part D, on one of your ID cards, okay? Part D is the outpatient prescription drug benefit under Medicare. Think of it as the part of Medicare that pays your UC plan to cover you for drugs. It subsidizes UC medical plan premiums. And when Medicare Part D came out in 2006, all of our Medicare plans premiums dropped. It's very valuable to our funding of our drug coverage. You should know that the prescription drug coverage of all UC medical plans for employees is equivalent to or better than Medicare Part D. Even Core, our cheapest plan with the highest deductible, has creditable prescription drug coverage. Why is that important? Well, if you retire past 65, you've got to have continuous prescription drug coverage that is creditable if you enroll in Part D later. Otherwise, Part D will charge you late enrollment penalties. All our plans are creditable, so you don't have to worry about late enrollment penalties as long as you enroll in Part D immediately upon retirement. And because you have to have continuous creditable coverage, after you retire and you enroll in a Medicare plan, if you retire past age 65, you may be asked about past prescription drug coverage if Medicare can't tell whether you had creditable coverage in your past. Don't let that throw you. If you're worried about it, give me a call. Other things to know about Part D, it's very valuable, but it does make things a little bit more complicated when you're retired and you have Medicare coverage. And that's because Medicare Part D, as in drugs, pays for most outpatient drugs, but not the administration of vaccines sometimes. Medicare Part B, as in boy, might pay for doctors injecting you with the drug. It gets complicated. So here's a tip. Once you retire and have a Medicare plan, if you get shingles, if you want to get the shingles vaccine, go through your pharmacy. You can get your flu shot either at a pharmacy or at your doctor's office. Okay? At a pharmacy, you're using Part D as in drugs. At a doctor's office, you're using Part B as in boy. So shingles shot, use the pharmacy. Flu shot, either way. Go either way, doctor's office or pharmacy. Other vaccinations, check with your plan. Make your life easier. Check in advance the best way for you to get your vaccinations once you have our Medicare plans and you're retired. Know that you're not going to pay anything extra for your Part D plan unless you're super high income. And I mentioned before that Part B premiums are higher for the top 5% earners in the US. Same for Part D as in drugs. But if you're not in the top 5%, you don't pay any premium for Part D. But because Medicare is paying somebody every month to cover you for drugs, that complicates or prevents double coverage. If you're eligible for UC coverage and coverage from another retirement system, like the military or CalPERS, or your spouse that's also retired from some union or something, consult with us. Double and triple coverage through Medicare and a couple of retirement systems gets really tricky I encourage you to consult with Erica or me, okay? And watch out if you are covered by one of our retiree plans with Part D and you get suckered into signing up for some other plan because you talk to some persuasive insurance broker someplace. Watch out. If Medicare stops paying your UC plan gets cut off. So don't do that unless you know what you're doing. Something else I want to throw out is for people who may retire outside California. Now, we have PPOs that will cover you anywhere, obviously. But if you and all covered family members are retired and age 65 and have Medicare, UC isn't going to let you keep the custom spectacular UC medical coverage that we've talked about combined with Medicare. Our Medicare coordinated plans will no longer be offered to you if you change your home address to something outside California. Instead, UC is going to send you to a giant insurance broker called Via Benefits, and you'll get local Medicare supplement plans through Via Benefits. Those are the same Medicare plans that anyone with Medicare could buy. Remember, this only applies if you change your home address, not your mailing address, your home address, and all covered family members are 65 or older and have Medicare. And Medicare doesn't pay for teeth or glasses or your legal plan. It doesn't affect your dental, vision, or legal coverage, just the medical coverage. But if you change your home address to something outside California, you're going to be sent to Via Benefits. UC will help you pay for your coverage by providing up to $3,000 per person per year every January, up to $3,000 per person, subject to graduated eligibility, which means that, for example, if you get 100% of the UC contribution, you'll get $3,000 every January per person. But if you only get 50%, for example, you'd only get $1,500 per person per year. And if you join Via Benefits mid-year, that amount would be prorated based on how deep into the year you switch to Via Benefits. So for example, if you switch to Via Benefits July 1st, you only get half of the UC contribution to the HRA, or health reimbursement arrangement. You're going to use that HRA money to reimburse yourself for what you pay for Medicare, Medigap, Medicare Part D, or Medicare Advantage plan premiums. So UC is really going to help you pay for your premiums. It takes a couple of months of lead time to get into Via Benefits. So if you have Kaiser, I want to warn you, you need to be on top of this. If you're going to be subject to Via Benefits, you need to give UC 2 months of lead time so that you have coverage where you land outside California. If you're in the other plans, I'm not so worried about you because you're in a PPO and you can use a PPO in any state, no big deal. But the Kaiser members need to give UC 2 months lead time to get into Via Benefits. Again, once you or a family member are about to turn 65 or otherwise become eligible for Medicare, call me, call Erica, call us 3 months before the month in which you turn 65 so that we can help you deal with Via Benefits or any other type of Medicare coordination. I also want to point out that UC pays Via Benefits to reimburse you for catastrophic drug expenses. And that's important because when you're under regular Part D drug plans, they aren't as nice as our custom plans. And you could be out of pocket as much as $3,000 per person per year just on the cost of drugs if you move out of California and are covered by Via Benefits. So what that means to you is that if you are thinking about moving outside California, you need to budget to spend at least, at most, roughly $3,000 per person per year just on the cost of prescription drugs. Beyond that, Via Benefits would reimburse you for catastrophic drug expenses. It's $3,000-ish because there are so many different scenarios, but budget roughly $3,000 a person and you'll be okay if you're going to move out of the state. I hope that made sense. Now, I've said this before, but I'll say it again. What do you do when you get your Medicare card? You call me. Call me, call Erica. We will help you coordinate Medicare with your plan. And to get the Medicare card, call us. We can help prepare you for your Medicare application so that it is much less painful. Help us help you sail through your Medicare application. Call us 3 months in advance and we will try to help you out. This is our contact sheet that you can download from our website with all of our contact information on it. And one of the things that it says on here is due to the complexity of health coverage, facilitators prefer to correspond by phone, okay? This stuff is complex. Going back and forth, back and forth, back and forth on email, very inefficient. I don't mind you emailing me, don't get me wrong. But provide your phone number if you email me, because I will more than likely want to call you depending on what you ask me about. Now I want to spend maybe 5 minutes on the future of UC retiree health coverage, just so you understand the big picture. Well, what does the future hold? Well, nobody really knows, but I don't have a crystal ball, but health plan premiums have continued to rise over time, and health plan premiums have exceeded the cost of inflation for many, many years. So we should just assume that things are going to get more expensive in the future. I also want to point out that fewer and fewer and fewer large employers offer any retiree health coverage. Okay, that makes it very valuable that you're working for UC. UC's retiree coverage is an extremely valuable benefit regardless, but it's even more valuable when you realize it's hard to get. Very few employers are offering it anymore. 27% of large companies are offering any retiree health coverage at all. That's down from 32% in 2005, 66% in 1988. So it's been going down over time. You're working for one of the employers that offers something special that most other employers do not offer. And we do it better than most other employers, if I must say. Maybe not better than CalPERS or the military, but our retiree health benefit is spectacular. You should also know that UC's contribution to health insurance is not a vested benefit. It's not guaranteed to employees or retirees. It never has been. And that's because it's pay as you go for the University of California. Here's what I mean by that. Your department is paying your employee premiums right now, okay? The fund that pays your salary is paying for your health benefits, which might be obvious to you. But what may not be obvious to you is that there is no set aside trust funds to pay it for retirees. The way retirees' premiums are paid is that there is a campus assessment fee applied to your department. Your department, for working employees, their departments, your department and my department, is paying a campus assessment fee of $2.36 for every $100 of employee covered compensation. So it's $2.36 for every $100 we make. Your department also has to pay into the fund that funds retiree health coverage and the healthcare facilitator program. Thank you very much. So just know that it's pay as you go. That's why UC doesn't guarantee it to anybody. But having said that, the university absolutely intends to continue the retiree health insurance program. It is a very valuable recruitment and retention tool because hardly any other employers offer it, and because you can't get coverage that's this nice on your own when you are retired. You just can't do it unless you get it through the military, the state of California, maybe some unions on the East Coast, maybe. The University of California retiree benefit is really valuable and really nice and pretty unique. Besides that, as a socially responsible institution, UC doesn't want to add to the problem of the uninsured in the United States, but really it's to recruit and retain employees. We want to get the hooks in you and keep you here as long as we can. Now, you may have heard that there have been reductions to the UC contribution toward retiree health over the years. Back during the last major financial crisis, UC assembled a post-employment benefits task force, which ultimately resulted in the reduction of the UC contribution toward retiree health. Okay, here's what that means to you. I was talking about what is 100% of the UC contribution, right? Well, you get 100% of the UC contribution toward employee benefits now as an employee. When you're retired, you may qualify for 100% of what UC will pay, but what UC will pay is based on 70% of aggregate medical plan premiums for retirees. When you're an employee, the UC contribution is based on 86%, but when you're a retiree, it's 70%. So yes, you're getting 100%, but 100% of a lower number. UC pays a little bit less toward retiree health than it does employee health. Once you get to once you get to having Medicare, it's not so big of a deal. But this means that if you don't have Medicare when you retire, expect to pay a lot more for your health insurance premiums. So again, age 65 might be a good retirement goal because it makes your coverage less expensive unless you're ultra high income. Something else the Post-Employment Benefits Task Force created was the new graduated eligibility rules that created the Group 3 eligibility that we talked about briefly earlier. Now, ongoing, there's a retiree health benefits working group that was initially going to talk about just the retiree health benefits program, come up with contingency plans in case there's another budget crisis. But ultimately, it was expanded to review the entire health and welfare benefits program for employees and retirees. And then since they expanded it, not a lot has happened. So I don't have any news in that regard, but there is theoretically a working group that is going to come up with contingency plans to try to minimize the impact on employee and retiree health premiums if there's another budget crisis. They're working on it. Last thing I want to talk about is for those of you who are actually going to retire this summer. If you're going to retire on July 1st, 2022, congratulations. Know that you need to separate on June 29th and retire on July 1st to get the inactive COLA, which you may have heard from other parts of this presentation, but I reiterate it because it's very important. You need to apply for retirement. You need to submit the request for retirement initiation 90 days prior to your target retirement date. So if you're going to retire July 1st, get it started on April 1st by signing into UC Raise, doing a retirement estimate, get that thing going 90 days in advance. Submit your retirement correspondence through UC Raise whenever possible. UC Raise being the retirement@yourservice.ucop.edu website. Retiree health forms, they're a little clunky through UC Raise. Consult with us and we'll tell you to fax forms usually. But when it comes to retirement paperwork, do that through UC Raise. Upload marriage certificates and birth certificates and whatever they need. Upload that through UC Raise whenever possible. Also know that when you retire, if you're eligible for retiree coverage, you should be getting an extra month of coverage when you retire. That means that if you retire July 1st, your coverage doesn't end June 30th. It ends July 31st. You get an extra month of coverage. That means that if you're eligible for Medicare or you have family members who are eligible for Medicare and you retire July 1st, your target Medicare Part B effective date is actually August 1st. So consult with us and we'll tell you how to get Medicare August 1st. Again, I've said it a million times, but if you are a covered family member, are 65 or older, or otherwise eligible for Medicare, contact us for assistance with Medicare enrollment, questions, coordination. Whether you're an employee or a retiree, we can help you think through and deal with the very valuable Medicare benefits. That concludes today's presentation on health benefits into retirement. Remember that whether you're an employee or a retiree, you can lean on us at the Healthcare Facilitator Program for assistance. Our website features all kinds of tools that you can use. It also features streaming video of me explaining all of the health plans. There's a page for employee presentations, there's a page for retiree presentations, etc. And all of our contact information is at your disposal there when you need us. But that concludes health insurance after you retire. Next, I want to hand the presentation over to my esteemed colleague, Dawn Goldberg.
And
Yes,
Don,
thank you, Darren.
Don, before you jump in,
Sure.
we do have a built-in 10-minute break so folks can take care of what they need to. And then we'll have Don present for 15 minutes or so, and then we'll have Q&A after. I know the chat is very live with questions. Don will moderate the Q&A session with Garen, and they'll do their best to answer lingering questions from session one, but mostly those bountiful number of questions that came in regarding healthcare and retirement. So we're going to take a quick break, and then Don will come back with your presentation.
And I will catch a breath.
Great job, Garen.
Thanks,
Thank you,
Garen.
Garen.
That was awesome. So we'll try to come back at 10:41. So it'll be more like 9 minutes or 8.5.
Hey, Kyle, when we come back, are you going to introduce me or should I just start going from that point?
I think you can start, Don, since most of these folks were in the room.
And you said 9 minutes from now?
Yes, sir.
10:41? Okay, thank you.
Absolutely. You bet.
From UCD employment to retirement. So today I'm going to cover the difference between the retirement date and the separation date, retirement dates for academic year faculty, what happens with your leave accruals, what happens to your UCD insurance coverages, notifying your department, and then other important resources. So what is the difference between the retirement date and separation date? And that's basically two dates you need to know. And the retirement date is your, I'm going to say your retirement date. That is when your retirement coverages begin. Your separation date is your last day on pay status. So we always use the example, if you're going to retire this year, July 1st, your separation date, in order to qualify for the inactive cost of living adjustment, has to be no later than June 29th. It could be June 28th, it could be the 27th, but you cannot be on pay status as of June 30th. So basically, that's what these slides are saying. So one thing that I did want to talk about too is if you are retiring July 1st, you will have two options. And we are going to go through a couple of different presentations in the near future talking about the retirement process. But if you are doing the online at UC Ray's retirement, which is highly, highly recommended, you can start your retirement as early as 90 days prior to the retirement date. If you cannot do it online or choose not to do it online, and you are submitting a form, you can submit that form as much as 4 months in advance of the retirement date. Another question that we do get in regards to the separation date is, on my last day of work, do I physically have to be at work on my last day of work? And the answer is no. So if you're on a European vacation and your last day of work is June 29th, you don't got to fly back to UC Davis to come back for that last day of work. Your last day of work, your separation date, can be a sick day, it could be a vacation day, or it could actually be a go to work day. So this here, I know this portion, this presentation is for staff employees, but we may have a few academic faculty on this presentation. So we're going to go over this pretty quickly. But for staff employees can retire any day during the year. Faculty, they have different days that they can retire. So if you are an academic faculty member and you are working in the fall quarter, you can retire on November 1st. If you are working through the winter quarter, your retirement date can be March 1st. And for all UC employees, July 1st is a good retirement date. If you are on the semester system, then January 1st is a good retirement date. And for the spring semester, July 1st is a good retirement date. For more information, please contact your dean's office. So what happens to your leave accruals when you retire? And this is a very, very common question that we do get. So any unused vacation time, PTO time, CTO time, that unused time is paid out on your final check. So that is important. There are a lot of different strategies that people do. Sometimes people will start physically working a month or two prior, use up that unused vacation time and vacation out. That is a very, very common practice that people do. But remember that if you are retiring July 1st, your last day on pay status, your separation date, can be no later than June 29th. In regards to sick leave, unused sick leave converts to service credit if you are taking the monthly benefit. If you are taking the lump sum cash out, you do forfeit any kind of sick leave conversion. The one thing too that I do want to mention in regards to sick leave is it does convert to service credit when you take the monthly benefit, but it does not convert to service credit to get you vested. So say for instance, you have 4 years and 11 months, it takes 5 years to be vested, and you have 1 month of sick leave. That sick leave will not convert to service credit to get you vested. So if you have over 5 years of service credit, any unused sick leave will convert to service credit when you take the monthly benefit. So what happens to your UCD coverages when you leave? So basically, let's go back to the July 1st retirement date. You separate on June 29th. So your UCD coverages will continue through the month of July, and retiree coverages will begin as of August 1st. There are exceptions down on the bottom. If you are on a disability, your coverages will end on the last day that you actively work. Also, if you are on the supplemental health plans, it ends on the last day of the last month of separation. So these are important things to remember. Garen did talk about it earlier, that you do have the extra month of coverages when you do retire. So when you do separate, your separation is processed by UC Path. They will continue your coverages. And Garen mentioned this also, that when your coverages end through UCD, you will automatically get a COBRA package. It does not mean that anything is wrong with your retiree health coverages. Doesn't mean that there's any problem setting anything up. This is automatic. They have to do it. This is a federal regulation. And please keep in mind too that everybody will get a COBRA package. And again, it can be ignored if you do not need COBRA coverages. Other important notes is you must notify your department that you are retiring so that they can put in the proper dates, your separation date and your retirement date. By coding you as being retired, that allows you to have that additional month of coverages. A very, very common question we do get is, when do I have to tell my department that I am retiring? And there is no set date. It's not like you got to tell them 2 weeks before, a month before. It is basically based on the individual. They have to let their department know, but there isn't a given specific time. I always feel that if you are pretty confident that you are going to retire, I would let my department know sooner than later. But if I was on the fence, I wasn't sure that I was going to retire, I'm thinking about it, I started the process, but I may cancel the process, then at that point, I wouldn't be too quick to tell them I'm retiring if I wasn't 100% sure that I am retiring. But it is very important to let your department know that you are retiring, because if they don't put in those dates, it will affect the processing of your retirement and your retiree coverages. So that is what I just mentioned. You do have to notify your department. The Retirement Administration Service Center will not communicate to your department. They're not going to look you up, see who your supervisor is and your manager, and then call them up and let them know that you are retiring. That is the responsibility of the employee. So at that point, you need to let your department know that you will be retiring from UC, what the retirement date will be, your separation date, that's the last day on pay status. And then they will work with your departments on processing the remaining unused vacation pay, the sick leave time will be processed, and they will coordinate with payroll the unused vacation pay and PTO being paid out. If you are vacationing out, like I mentioned earlier, you're stopping work, we'll say a month earlier, and you're going to be on paid status using vacation time, that is subject to departmental approval. So here is our additional resources. UCNet basically has all the good information that you would ever want to find about the UC retirement. There are recorded presentations that personally that I've done when I was at the Retirement Administration Center. There are upcoming webinars. They have that there as well. Also, UC Ray is a very valuable website. This is where you can actually start your retirement through self-service. You can see your retirement estimator at the UC Ray's website. There is the retirement handbook that can be found at UCNet, as well as the survivor and beneficiary guides can also be found at UCNet. Additional resources, if we'll call it the Retirement Administration Center. Their phone number is there, 1-800-888-8267. Fidelity's phone number, 866-682-7787, as well as the Net Benefits website. Other important resources is our benefits office, and that's our email address, as well as UCPath, and the UCPath contact information is there on the bottom as well. So now we're going to turn it over to, I'll say myself and Garen, I'm going to start scrolling through the chat questions, and I'm going to try to answer as many as I can and pass the rest on to Garen. So let's take a look. Garen, are you back?
Oh, I'm here. I'm ready.
Okay, good. Okay, so the first one actually I'm taking a look at is they're asking about sick leave. If significant sick leave is accrued, is it possible that the service credit will round up to the next full year of service? So what I would say is the service credit is the service credit, meaning that there is no rounded up. I could give you probably a very bad example of no rounding up, but one time I was processing a retirement for an actually UC Davis employee, and they thought they were going to have 5 years of service credit. And then when they did the final calculation and audit, this employee ended up with 4.9997 years of service credit, falling short of the 5 years of service, and they were not eligible to retire. The good thing is UC Davis is a great place, and after about a couple of months, they eventually were able to get this employee back who was able to work another month to qualify based on 5 years of service credit. But to make a long story short, there is no rounding up.
I want to throw in that the service credit does help when it comes to calculating your eligibility for health and welfare benefits. So sick leave does convert to service credit for that purpose. So if you retire with 17 years of service credit and a year of sick leave, that's 18 years of service credit for pension and retiree health calculations. So hoard that sick leave, don't waste it.
That is true. So if I didn't say that correctly, service credit does convert to service credit, but it does not, there is no rounding up feature to that. So one of the questions here is, if we submit our retirement through UC Rays in April, can we go online before that and fill out the forms and upload documents and save them and not submit it to until April 1st? And basically, I would say no, because for that portal to be open, you have to have initiated your retirement. So you can't go into the UC Rays portal in advance of starting your retirement and submit those documents. So here's a question. Goes, I'm a little confused about how things work if Social Security retirement date differs from the UC retirement date. They're a little bit confused about health coverage and medical coverages.
Maybe I'll take that one.
Okay, good.
I can explain. When people retire, they might be old enough to get Social Security income, but they may not want to take Social Security income right away. because if they do, they'll take a hit on how much they get out of Social Security. Some people will wait till age 70. Some people will wait till age 66 and a half, whatever it is. Keep in mind that it doesn't matter to UC whether you're getting Social Security income. That's completely up to you and your financial planner. It's between you and Social Security, really, whether you get Social Security income and when. It's somewhat irrelevant to us. What does matter is Medicare at age 65, or if you're eligible for Medicare earlier. Regardless of whether you're getting Social Security income, if you're 65, then you need to be applying for Medicare. And if you don't get Social Security income, then you'll have to pay your Medicare premiums manually. If you do get Social Security income, things are easier because when you have Medicare, your premiums will come right out of your Social Security check, easy peasy. And the other thing that makes that easy is that if you are already getting income from Social Security before you turn 65, you're already on their radar and they just mail you a Medicare card without you having to do anything, maybe 4 or 5 months before you turn 65. So getting Social Security income can make things easier, but you don't have to take it unless you are holding out for a later age and a higher payout.
Okay, great. Now I got another one for you. I know you talked about it in the presentation, but if I get married less than a year before I retire, will my new spouse be eligible for health benefits with me?
Yeah, the answer is no. I mean, you have to be married for at least a year prior to retirement to qualify for survivor benefits. So I would say, don't retire yet. That's an extremely valuable benefit to have your spouse protected for the rest of their lives. I would hang in there if possible and continue to work at UC until at least the year had passed in order to protect my spouse. But if you can't do it, you can't do it.
Okay, can we clarify that, Garen? Basically, if somebody gets married less than a year before I retire, will my new spouse be eligible for health benefits with me while they're still alive?
Oh, yes, they can be covered by your health insurance. I'm concerned about the survivor benefit, though. A survivor benefit would not be payable if you haven't been married for at least a year prior to the retirement. But as I talked about in the presentation, retirees can cover spouses, definitely, on their health insurance.
And one other thing too is it's you do have to be married for 1 year prior or more. Also, you have to remain married, which is going to be that could be the tough part in retirement. Okay, so now we got another question. Can the separation date be 6/15 or 5/30 to get the inactive COLA on 7/1? And I could answer that one. So basically, we recommend the separation date needs to be before June 29th June 29th or before to qualify for the inactive COLA. However, let's just use the 5/30 separation date. If you were to separate 5/30 and not retire, you are foregoing basically a month of retirement income that you could have collected by retiring on 6/1. Also, with that 5/30 separation date, you will not get the extra month of retiree health. So therefore, for the month of June, you would have to have COBRA coverages or different coverages. So you definitely, I would say, want to at least have that separation date in June to get the extra month in July. But you want to make it as close to June 29th as possible, because when you separate and you don't retire, there is no income. So you don't want to forego retirement income or regular pay in order to get the inactive COLA. Okay, so I'm going to read this. So what happens if the entire department gets nixed? Will campus in general continue to fund it for existing and current retirees?
I'm going to let you take that one,
Oh, for
Don.
me? Oh, okay. I think
I
this
don't know how
pertains
to
to
answer
that pertains to the retiree health.
Oh, they're asking about retiree health?
Yeah,
In the case
I
of the
would
entire
think so,
department?
because the way that I'm looking at it is you mentioned how the department contributes towards the, towards the health insurance. So if the department goes away, what happens to the funding of the health insurance?
Okay, well, if that's the direction of the question, it doesn't matter what department it is. If you're an active employee, whatever funding source is funding your income, that same funding source is being charged the campus assessment fee to fund retiree health. So if an entire department is eliminated and those employees are absorbed into another department, then that new department is paying the campus assessment fee. If those employees are laid off, then there's no more income, there's no more pay, there's no more campus assessment fee. And only the active employees who remain, their departments would be paying the campus assessment fee. So think of the campus assessment fee as a tax on any department that hires an active employee that they're going to pay on all their active employees, but not their retirees, because they're not paying their retirees. The retirement plan is. I hope that helps clarify it.
Yep. Now I got another one for you. It says, we got a couple of these that came in through the chat. I am very confused about Medicare Part D. Is it necessary to sign up for Part D if you have one of the UC plans?
So I appreciate the question, but I'm going to say that the answer is going to be different depending on whether you're an employee or a retiree. While you're working here, you don't need a Part D plan as long as you're covered by one of our medical plans. The only exception, no, there are no exceptions. You don't need Part D while you are working here. However, if you are retired, then you absolutely need to have Part D, and you will almost always need to get that Part D through UC unless you have another source. And that other source could be CalPERS or the military. We do have people who are retired military and they are eligible for TRICARE for life when they turn 65. We also have people who are married to CalPERS retirees who get drug coverage Part D through CalPERS. If you can get your drug coverage, creditable drug coverage, through another source besides UC, then we do offer one plan that doesn't cover Medicare Part D. It's called the UC Medicare PPO without prescription drugs. And it's a very special plan that's only available to people who can be essentially triple covered by Medicare, UC, and a third source, which is almost always CalPERS or TRICARE for life. That's one of the reasons that I encourage anybody who is eligible for coverage through multiple sources. If you can be double or triple covered, you need to be consulting with us because it's not simple. I would say call me sometime.
Okay, so here we got another one. Will my daughter, 21 years old, a student, can she be eligible for benefits?
And the answer is yes, just when you're an employee, when you're a retiree, either way, UC covers natural or adopted children to age 26. There are no other qualifications required. Now, there can be complexities if you are in an HMO and you're covering, let's say this 21-year-old goes off to college in New York, and you're in an HMO. Well, that's a problem for you because HMOs don't cover you outside the prepaid medical group unless you're going to an emergency room. And emergency only coverage is not acceptable for somebody who's on the other side of the country. You would either need to get student insurance for them in this example, or you need to change the whole family to a PPO so that you have health insurance. Health insurance, as opposed to HMOs, works anywhere. So again, you could consult with us and we'll help you figure out what you need to do. But yes, 21-year-old children, natural or adopted, are covered whether you're an employee or a retiree to age 26. And if you didn't know this, we can cover children beyond age 26 if they are permanently disabled and dependent on you, or if they get Social Security income for disabled people.
Okay. Next question is, what benefits are available at the 20 years of service marker versus retiring less than 20 years of service?
And the answer is the same benefits either way. It's just that if you retire with less than 20 years of service credit, you will likely be getting a smaller percentage of the UC contribution toward that coverage, which means that it will cost you more. For details, play around with that UC retiree premium estimator. That Excel spreadsheet will show you the difference. You can play with it. You can say, you know, what if I retire with 17 years versus 18 years versus 19 years versus 20 years? And, you know, what that may do is convince you to stay here longer. So watch out for that. But it will help you budget because you'll understand the difference in your outlay for premiums based on different retirement scenarios. I hope that answers the question.
So the next question I'm going to answer, the question is, does sick leave convert 1-to-1? Every hour of sick time equal? And the answer is yes. All unused sick leave does convert to service credit. Basically, the conversion is your unused sick leave hours get divided by 2,000, and that will increase your service credit when you take the monthly retirement income. So if you have 1,000 hours of sick leave, you divide that by 2,000, that will increase your service credit by 0.5 when you take the monthly retirement income. It does not change your retirement date. It does not change your separation date. It just increases your total service credit. Let's see. Okay, so this question is, does the retirement date have to be a weekday? And the answer is no. The retirement date basically can be any day, including a weekend. Next question is it worth waiting until you turn 60 in August this year to get the age factor, or go in and retire July 1st for the inactive COLA? And I would say, I can answer this one, Garen. So the question is, again, if you retire in August and you are turning age 60, and we're going to assume you're in the 1976 tier, hired before July 1st, 2013. So you would be eligible for the inactive COLA if you were to retire July 1st. So if you were to retire in August, you are foregoing the inactive COLA this year in 2022. And because you have retired in August, next year, come July 1st, 2023, you would not be eligible for the retirement COLA. So in essence, by working the additional month or so, you'll get one more month of service credit, one more month of age factor, but you will be foregoing 2 cost of living adjustments. Conservatively, that would be 2% each year, and that would not be worth it when you add it all up. So, and you could always go to the retirement estimator. You could put in a August retirement date, a July 1st retirement date, factor in the inactive COLA that you would be eligible for. And then you would also have to consider whatever that July 1st, 2022 date is, that you would be eligible for a retirement COLA in 2023 that you will not get if you were to retire in August. So to make a long story short, it would be in almost all cases better to retire July 1st versus waiting till age 60 in August. Okay, so the next question is, if 100% contribution is already reached, is there a reason to stay after 20 years of service? Are there any additional benefits for those that stay 25, 30 years of service?
That's a great question. And really, you can't get more than 100% of the UC contribution toward medical and dental. It doesn't go up to 120% or something like that if you get more than 20 years. No, it just stops at 100%. So even though you've maxed out your UC contribution toward medical and dental, working longer gets you closer to age 65. Age 65 means Medicare. Medicare usually means you save a ton of money. So while it doesn't increase the UC contribution, working till 65 might be another goal, because it it just your benefits are just better and cheaper when you have Medicare when you're retired. And it goes without saying that the longer you work here, the higher your pension is going to be, because you're making more service credit. But it does get you closer to Medicare, which helps. If you're past Medicare, then I would say you're just earning additional service credit, which improves your pension. It's not helping your health insurance situation.
Yeah, I'm glad you mentioned the retirement portion, because I was going, so if you were to retire at 20 years of service, now you're eligible for 100% of the UC contributions. And if you were age 60 in the 1976 tier, that would give you 50% of your HAPC. However, if you were to work 30 years, you would get 75% of your HAPC. So there are tremendous benefits, we would say, by continuing working, but you did reach the maximum 100% of the UC contribution for health and welfare benefits. So this question I can answer. I'm planning to retire May 31st. So I have to submit my separation day by June 1st and entry documents online by February 28th. So I'm going to try to decipher it. Okay, so I think what's happening here is the actual retirement date is June 1st. And the separation date would be May 31st, because the separation date is before the retirement date. So just to clarify that, so your separation date would be May 31st, the retirement date is June 1st. And if you were doing this online at the UC Ray's website, you could do this 90 days in advance of the June 1st retirement date, which would be, I would say March 1st would be the earliest, give or take a day. So it's 90 days in advance of the retirement date. If you are doing it online, if you are submitting a form, and which I would not recommend doing it the old-fashioned way, you could do it 4 months in advance of the retirement date. Okay, so this one's for you, Garen. If I move out of state upon retirement and change my home address, can I stay with a PPO plan?
So the answer depends upon whether you and all covered family members have Medicare. If you have a PPO right now, like let's say you have the UC Health Savings Plan and you retire and then you move, no problem. The UC Health Savings Plan is health insurance. It works anywhere. If you, the only catch would be, once you're eligible for Medicare, if you no longer have a California home address on file with UC, once you and all covered family members have Medicare, we would flip you from UC benefits to VIA benefits. And the VIA benefits means that you could be out of pocket many thousands more per year just on the cost of prescription drugs. You'll have a lot more choices, and UC is going to help you pay for the plans through VIA benefits. But that Medicare Part D is weak compared to our custom Medicare plans if you stay in, if you keep a California home address. So yes, PPOs work anywhere. The difference would be Medicare and all covered family members being age 65 or older. That's what flips you to VIA benefits.
Okay, so the next one is for you as well. And it goes, if my wife and I both work for UC, I am in the 76 tier and she is in the 2013 tier, is there any advantage of putting her on my medical plan prior to retirement?
That really depends on, you need, if, for you to think about that, you need to be thinking about which salary band is which spouse in. The higher comped employee might be paying a lot more for health coverage versus the person in the lower salary band. You need to think about who might be retiring first and how much service credit that person has at that time. I mean, a simple example would be you and your spouse both have 20 years of service credit and you're both age 65 when you retire, then you're both going to qualify for 100% of the UC contribution. And so it would be irrelevant. But if the 2013 tier retiree didn't get 100% of the UC contribution, you'd have to make a calculation. You'd have to decide, well, should I add them to my employee benefits now so that when I retire together, we both get the higher UC contribution toward retiree coverage? Or if I do that mid-year when I retire, am I going to spend too much on premiums to make that worthwhile? Because the timing in the year of when you do it matters. Because if you're an employee in a high salary band and you add a family member and you're paying the higher premium that whole time, that's going to offset any savings that you might have had comparing the two retiree contribution rates. So there is no real simple answer to this without doing math that is going to be very variable depending on your circumstance. So if you have difficulty determining what's the best strategy, I would say give me a call sometime. We'll figure it out together.
Okay, so the next question is, what happens if my home address is in California, but I'm traveling 6 months a year?
So if you are someone who is in California and you will be beyond, outside the HMO service area, if you have an HMO, then you need to switch to health insurance. You need to switch to a PPO. Give me a call and I'll help you do that. That way you'll have coverage wherever you're going. Remember, the threshold is 2 months. You can't have an HMO if you're outside the service area for more than 2 months. If you are already in a PPO, then you already have health insurance. Health insurance works anywhere. So you don't have to worry about changing plans. For example, let's say you had the UC Health Savings Plan or UC Care or CORE, or you had the UC Medicare PPO, or you had the UC Medicare Choice Plan. Those are all PPOs. You could use those anywhere in the United States. I will add, in case it helps anybody, that let's say you're in a non-Medicare PPO through our Anthem plans and you're in another state. Well, you need to use preferred providers when you're in the US. When you're outside the US, you are not required to use preferred providers that belong to the Blue Cross Blue Shield International Network. But you can be advantaged if you do so, because there aren't that many preferred providers outside the US, but those that do, there's a chance that some of them may be able to bill US insurance for you so that you don't have to pay entirely upfront and then submit a foreign claim for reimbursement. So if you don't have Medicare and you're in one of those plans, you can travel all you want. Try to use preferred providers if you want to increase the odds that you will not have to pay entirely upfront when you're outside the United States. Inside the United States, just use preferred providers. No big deal. If you're in one of our Medicare PPOs, you have spectacular out-of-country coverage and you're not required to use preferred providers, but you must understand that Medicare does not pay outside the US. So if you're a retiree with the UC Medicare PPO or the UC Medicare Choice Plan, you cannot be outside the United States for more than 6 months and retain those plans. Medicare doesn't pay outside the US, so if you're going to be outside the United States for more than 2 months, well, you got to switch to either UC Care or CORE. UC Care and CORE are our international PPOs. But if you're inside the United States, and it doesn't matter how much you're traveling, as long as you don't change your home address to something that's outside, California, you're not going to have any effects, even if you're in one of the Medicare plans. They work anywhere in the US, the same as they work in California. But if you're a Medicare eligible member and you change your home address to something outside California and all family members have Medicare, you're going to get sent to via benefits. So that's, I hope I covered all the bases there.
Okay. So the next question is, I have HealthNet Blue and Gold now. Can I change to Anthem Blue Cross at retirement?
Excellent question. That is a very good question that I usually try to mention, but I don't have it anywhere in writing. And that's this: UC does not allow retiring employees to have a PIE, a period of initial eligibility, to change health plans. You don't get to change plans when you retire just because you retired. You just continue in the plan that you're currently in. But there are exceptions to that. Let's say that you are currently working for UC Davis and you're in Kaiser or HealthNet because you work in Davis or Sacramento, but you live up in Truckee. This happens. You can qualify for an HMO if you work in the service area and you don't have family members to worry about in Truckee. You could be covered by HealthNet or Kaiser and just use doctors in Davis or Sacramento that are prepaid by your HMO. But as soon as you retire, you will no longer have a qualifying work address because retirees aren't working. We can't give you you can't qualify based on a work address if you're retired. So you've got to qualify for your HMO based upon your home address. And if that home address is outside the service area of an HMO, you're going to have to change plans. So there are circumstances where you might retire and be required to change medical plans. But if it's just something you want to do, you're going to have to wait for open enrollment. Or if you're really desperate, adopt a child or marry someone, and then we'll have to let you change plans.
Yeah, yeah, really desperate. Okay, next question for you. Both my spouse and I are in the 1976 tier. He retired 2020 and me this year. Should we each cover ourselves or should one of us cover both?
Okay, so the answer to that is variable depending upon how much service credit each of you retired with. If it's not obvious, the retiree with more service credit at retirement, if they aren't subject to graduate eligibility, or if they're subject to it, but they get a higher payout from the UC maximum contribution, then you're going to want to go with the retiree who gets the better rates in retirement. And you'll want to compare with the premium estimator. But let's say for simplicity's sake, that both of you have at least 20 years of service credit. You're both in group 2. You both get 100% of the UC contribution when you retire. There really is no advantage of bundling together. You won't save money necessarily once you get Medicare by being unbundled. Until you get Medicare, you will notice that you save a little money by being unbundled versus one of you covering the other. But once you're Medicare age, it's the same price either way. And it really doesn't matter whether you're bundled or unbundled in terms of a medical plan premium. You're going to pay the same either way once everybody has Medicare. But if it doesn't affect the health insurance premiums, there's still a good reason to unbundle if you can do it. And that reason is this: if you are covering somebody on your health insurance and you predecease them, if you pass away, then they're going to have to qualify for their health coverage through the survivor pension benefit. And it takes the retirement system a few months minimum to get you a survivor's pension. And they try to prevent hiccups in benefits eligibility for these survivors, but they can happen. It is going to be less stressful for your spouse if you predecease them if they already have health coverage to their own retirement. So for that reason alone, if it doesn't save you money on health coverage, I would say unbundle. That may be more information than you wanted, but that's the reality.
And you could unbundle during open enrollment?
Any open enrollment.
Okay.
Bundle or unbundle, whatever saves you the most money, whatever floats your boat.
Okay, so the next question is, if I move out of state upon retirement and change my home address, can I stay with a PPO plan?
Well, I mean, you didn't say anything about Medicare with this question, so I'm going to answer it without Medicare and with Medicare. Let's say you don't have Medicare. Then if you already have a PPO plan, you will just remain in your PPO plan and just use preferred providers wherever you land. But if you have Medicare, then if all covered family members have Medicare and are 65 and over, then you're not going to get to keep your current Medicare PPO through UC. You're going to have to switch to something through Via Benefits. And Via Benefits is going to offer you standard Medicare supplement plans that really aren't PPOs, but that work like PPOs. So the most similar thing to our UC Medicare PPO, for example, would be a Medigap plan. Medigap plans let you go to any Medigap provider, same as our Medicare PPOs would. So you would probably choose a Medigap plan and Medicare Part D through Via Benefits wherever you land, if you go to Via Benefits. I hope that answers it.
Okay, so the next question I'll read and I'll answer. If we are due to accrue 14.77 hours of vacation on June 25th, and the last day worked in June 29th, do we get the vacation accrual? Should we count it on our vacation hours when vacationing out? And basically, so now you're vacationing out and your last paycheck is going to be at the end of June. You will accrue the vacation hours for the month of June. But the way that I see it, when vacationing out, those hours would be available once you receive that check. It would be available to be paid out as unused vacation hours. But I would say you couldn't use it during, that's a unique question, during the time that you're vacationing out, because you're going to receive it. That's a good one. It's just a matter of timing. But you don't want to cut it that close. You know what I mean? That if it's a matter of that 14.77 is included or not included, then you may not want to cut it that close that you would be unpaid, if that makes any kind of sense. But you will earn accruals in the month of June that you will get credited for at the time you get at the end of the month. And can you use it for that same month? I'll take my original answer back, and I think that should be okay, but that is something you may want to check with payroll just to be 100% sure.
I'm glad that you didn't give me that question, Don.
Yeah, that was you know, I've gotten, we'll say, thousands of questions over the years, but like as it's, that one I didn't get specifically, so that was a little bit more challenging. So this one over here, it says for vacation payout added to the last check, can those monies be used to fund the 403B 457? So I could answer that. So the unused vacation that is paid out, basically what that question is basically saying, can I roll that money over the unused vacation hours on my last paycheck? And that can be done, but the timing is very crucial. So say, for instance, you want to roll it over to your 403B and you are paid on a monthly basis. So now your final check will be the end of June, we'll say. So now it is June 2nd. You already received your June 1st monthly check. Now you could go into the Net Benefits website. You could go in as a, you know, again, after June 1st, June 2nd or so, go in there, and then you could change your contribution level up to 70% to your 403B. So in essence, that final check that will be all outstanding wages plus any unused vacation, 70% of that will go into the 403B, assuming that you have that bandwidth. And what I mean by that is there's only so much you can contribute to the 403B in a given year. And if you are over the age of 50, the most you can contribute is 27,000. So as long as you are within that 27,000, if 70% goes into the 403B, that should be fine, no problem.
Don, that leads me to a question,
Okay.
and that is for you, and that is, how important is it, if you really want to tax defer as much as you can from your employment income, to get it to come out of your check using the method that you just described? Is there a way for you to transfer money from a checking or savings account to your Fidelity account, and then at tax time, get a tax statement that essentially makes that after-tax contribution pre-tax, so that you can catch up missing contributions later? Is there a way to do that?
That's a good one. So you're saying that the way that I was thinking is we'll save that for Spencer, but
Okay.
next week. But the way that I was understanding that question, I didn't see that being the case, that it was going from your checking account into the Fidelity account, because it has to be done on a pre-tax basis. There are different retirement plans that if it comes from a retirement plan and it comes into your checking account, you have a certain amount of time to roll it back into a retirement savings program. But if it, like, you got $2,000 in your checking account, you can't randomly put it into your 403B.
Has to be payroll deduction is what I'm
It has to
hearing.
be payroll deducted. That's a good way of putting it, yes. Okay, so let's take a look here. Some new questions.
Oh, I see an HSA question. I'm going to jump on that.
Okay, good.
Can you make additional pre-tax HSA contributions after you retire? And the answer is yes. But remember, UC doesn't let you deduct anything from your pension check other than medical, dental, and legal premiums and tax withholding. That's it. So the way you would contribute to your HSA after retirement, this is for people who have the UC Health Savings Plan and retire with it. You would that's exactly what I was talking about, asking about Dawn. With the HSA, you can transfer money from your checking or savings account to your HSA, and then Health Equity issues a tax statement at the end of the year that makes all of your contributions pre-tax. So retirees can't directly contribute from their pension check, but they can contribute from their checking or savings account.
I can jump in, Don, and relief pitch a little bit here on some of the questions. I know you've been at it for a while. There are two that I see. So the first, and I can answer both of these, I think. So can you address the possibility of being 50 plus in age with greater than 20 years of service credit and anticipating a layoff for lack of funds, assuming that's in a department? So as long as you separate within 120 days in that instance, you would have full health coverage, assuming you're in the 1976 tier. Garen, if you can give me a heads up, I'd appreciate, or a thumbs up, I'd appreciate it.
Yeah, group two, you got it.
Yep. And your pension would be based on your current age factor plus those years of service, just like it normally would. So theoretically, if you retired within 120 days, you could get your benefits, you could start taking a pension, and if you wanted, you could seek employment elsewhere if you weren't ready to stop working while drawing that retirement. Additionally, if you get rehired at the UC within 120 days, then you would continue to accumulate service credit just like you had in the past. You would not be benefits covered for after the month after you separate, essentially. But when you came back into the UC, your health benefits would come on if you didn't retire immediately after that, which is where it can get a little sticky. If you retire, you get a pension check, and then you were to come back as the full-time employee, you would re-enter at a different tier. And Don, maybe you can clarify if you were to lose your position and technically be separated, and then you came back, even though it was a layoff and not a choice of your own, would that make you a two-tier retiree? If it
Yeah,
was
but
at
that-
120 days?
yeah, it depends upon the timing, but I'm glad I wanted to chime in anyway on a different factor. So let's take this from the beginning. So you're 50 and you got 20 years of service credit. So now if you were to be laid off, there's two things to consider. The first way that I would look at it is the health insurance very important to you? And it may be, but then again, it may not be. You may have a spouse who has coverages and you may not need the coverages. So at that point, we'll go back. If it was important, you want to retire so you can maintain the health coverages. The negative of retiring at age 50 is if you would have waited till age 60, the money that you would receive at age 60 would be 2.5 times what you would have gotten at 50. So it's really a tough one. It depends on what is most important. If there is a need for the health coverages, then you probably would want to retire at age 50 to maintain your health benefits. And the one thing to keep in mind too, like Kyle mentioned, is even if you do retire at age 50, that doesn't mean you can't come back to UC. You could come back to UC as long as you took the monthly benefit. And I've seen a case where this goes back a year ago, actually a few years ago, and somebody got laid off, but they did not retire because they thought they were going to get back into UC right away. To make a long story short, they did not get back into UC right away, and they lost their health coverages. So, that even though the goal may be to get back to UC right away, you want to plan as if you don't get back to UC, because you don't want to risk anything by saying it's going to be okay, I'm going to get back, I don't need to retire, and then forfeit the health coverages.
Thanks, Don. Makes sense. And yeah, in particular, if that health insurance piece is important, getting retired within 120 days is a priority there. There was another question, which I can also answer. And I'm also going to ask folks for 403B, 457B, and DCP questions. Spencer and Kim next week are going to give you just a harvest of information about those. And they can talk a little bit more about these scenarios too. But can your vacation hours that you're rolling over to, we use an example of a 403B by doing payroll deduction, just like you normally would through your Fidelity account. Can those be broken up into your 403B, 457B, and DCP? And the answer to that is yes, but you're the person that has to go in that month that you're retiring and change those contributions so that they match up. You still can't exceed whatever the tax limits are for those particular accounts taken as a sum. Additionally, you cannot exceed, Don, is it 70% of your paycheck essentially is kind of the guiding rule?
Yeah. The website won't allow more than 70%, but I'm going to jump in a little bit more too. The 403B and the 457B, you could go in there the same day and make the changes for both, but the 403B will come out first. The 457B will not come out until a month later. The 457B is a deferred compensation plan. So in order for your changes in June to come out, or for that paycheck in June, you have to go into the 457B in May to make that change. In my example for the 403B, you could go in there, we'll say June 2nd, and that's why I specifically said 403B. I didn't say the 403B and 457B, because that could be done right away. The 457B is more complicated, and if you wanted it to come out of June's payroll, you would have to make that change in May. But the ultimate experts on that are Spencer and Kim. They'll talk about it more next week.
And Don, while we're on it, can you talk about timing with the DCP?
DCP is that's a good one. We don't get that question too often, but the DCP is after tax. So the DCP, I believe, happens somewhat more in lines with the 403B. The 457B is a deferred compensation program. future earnings. The 403B is immediate. As far as I know, the defined contribution plan, DCP, is immediate as well.
Awesome. Thank you. Karen, this is one for you. UC has attempted to reduce the 100% contribution amount over the years. My understanding is that includes some folks that already had 100%. This may have been resolved with new tiers. Question, once retired, can the contribution percentage from UC change, or is it locked in?
Good question. It's locked in. They don't change the percentage of the UC contribution that you get when you retire. What they would change if there's a budget crisis is what is the maximum UC contribution. You're qualifying for 100% of something, and that something can change based on the budget. But what they did to try to prevent further issues with the budget is that they reduce the amount that UC contributes by changing the maximum contribution, so that instead of, prior to the changes, I think UC was paying something like, I think the UC contribution was something like 92% of Medicare retirees premiums and 86% of non-Medicare retiree premiums. And they stepped that down over time until both are at 70% of aggregate rates. So you don't have to worry about your percentage changing, but you would want to be aware if UC reduced the way it calculated its maximum contribution, because it can do that. Their health insurance is not guaranteed to anyone, but those changes, what they tried to do was step it down to 70% so that they wouldn't have to make changes in the future. Hopefully it's been 70% and it will continue to stay 70% for a long, long time, if not forever.
Thank you, Karen. Question comes in, where and how can I verify my service credit? The UC Raise site shows the same service for November and December 21, even though I worked my 90% schedule. Don?
Yeah, it's the UC Raise website is where you could see your service credit, but it can take a while. So like, I haven't looked at it recently, but we're in the month of January, December. The last time I looked, it was showing through the end of November. I'm not sure if December's has been accrued yet, or it has changed at the UC Raise website. But around the 20th of the month or a little bit later is when we'll see the accruals for the month prior. So that is something to keep in mind. It could have just been a timing issue that you could have looked and it showed November's, then you went in December. It didn't show the increase, but it may have been prior to when that change occurred at UC Raise. It does tend to be later in the month, in the 20s, before the previous month is shown up at UC Raise.
And I just checked on, and it's still on that November 30th date. So it should be updated here in the next couple of days.
True.
Additionally, one note to tack on to that is if you do use the retirement calculator, it should accurately reflect, provided you put in your position and appointment appropriately, what your service credit will look like at the end. If you do find a large discrepancy, let's say a couple of years are missing, that's when you want to get in contact with the RASC in advance and try to get those resolved, because as you go through the retirement process, those years of service aren't going to be reflected appropriately. And those are few and far between now that the system's moving a little bit smoother. So if you do notice that, you'll want to get in contact with the RASC. But one thing I do want to mention while we have everyone still here is if you do need to get in contact with the RASC currently, we got a memo during this meeting actually that their entire phone line went down today. And so they're waiting for it to come back up. I would recommend waiting to call until Tuesday of Wednesday or next week if you can wait. If there are questions that you think Garen, Don, or myself might be able to answer, you can connect with us as well.
Yeah, I found a good question that I want to address if now's a good time.
Perfect.
There's a question in here that I kind of addressed tangentially, but I want to say more directly. This question is, my husband retired last year. He suspended healthcare coverage because I added him to my plan. He has 80% coverage. I will have less than him when I retire. Can we activate his coverage for both of us when I retire to have the higher coverage? So what they're trying to get at here is that we have married employees with differing amounts of service credit. They want to know if they can bundle or unbundle their coverage at retirement, and UCOP absolutely does not allow that. You cannot change your health plan or enroll under somebody else's health plan mid-year normally. Now, if one of you was to lump sum cash out and the other person was to retire, that would be different because the involuntary loss of coverage rule would let you bundle up under the person who takes the pension. But assuming that neither of you does the lump sum cash out, because you cannot bundle or unbundle at retirement, you have to do a calculation and decide whether it makes more sense to bundle during the open enrollment prior to retirement or bundle under the open enrollment after retirement. So for example, if you're going to retire July 1st and you bundle under the previous open enrollment, then you're going to have coverage as an employee for January through July. That's 7/12 of the year through UC Davis. So once you're retired after July 1st, you'd be covered by the retirement system August 1st forward. That's 5 months. So factor that into your calculation. Do you want to pay a bundled premium for 7 months as an employee, or wait till the open enrollment after retirement to bundle? The numbers are going to vary depending on the circumstance. But since you can't bundle or unbundle at retirement, you got to use open enrollment before or after. I hope that makes sense.
Thanks, Karen. Well, folks, we have reached the end of our time for today. We really appreciate you tuning in. Garen, Don, we appreciate you both so much, and thank you for lending your time, your talent, and your ability to answer very difficult questions to us. I'm looking forward to seeing both of you here shortly in an hour or so, but for the folks here, we'll send out our survey as per usual here shortly. If you have any questions, you can always reach out to our office. Those of you that have asked some questions, you know that we've rerouted a few when we can't answer them, but we'll do our best to provide you with those resources. Garen's contact information is available on the Transitioning to Retirement Workshop page. So if you need to get in contact with Garen, you can correct me if I'm wrong here, but your preferred method is that they call and leave a voicemail if you don't pick up, and email as a secondary option, just because Garen is fairly slammed right now with retiree health questions from the open enrollment period as well as employee health.
Yes, I definitely prefer phone. I don't mind email, but if you email, know that if you're in a hurry, call me for sure. I'm often 2 weeks or more behind on email. And if you do email me, please include your phone number.
Awesome. Well, thank you both. And thanks to everyone for being here. We're going to let you go. The survey will be in your inbox, hopefully in the next 5 minutes. So if you could fill that out, we'd really, really appreciate it. But thank you, everybody.
Thanks, everybody.
Thank you.